We haven't gotten modelling since the spring. Quote, "The modelling we are undertaking is more about those kinds of planning scenarios, and it's not yet complete." That's the CMO on October 5th. Since then, we've seen multiple leaked memos from AHS showing case projections for ICU, admissions, and hospital capacity. Yesterday, the minister himself said his models are a flashlight and he works within the numbers. Alberta Health has modelling, AHS has modelling, the minister has modelling. Albertans do not have up-to-date modelling. Why is that in the middle of a pandemic? Why won't he tell Albertans what they're up to?
The Minister of Health.
Those numbers are going to change. We still have the elevated, probable, and low scenarios that we're going to be dealing with as we respond to the pandemic. We knew at the beginning in the spring that we would be entering into the first phases of any response to a new virus that would be continuing with the containment phase, and we're now in the mitigation phase. We're going to continue to use those numbers going forward and continue to work with AHS to make sure that they have all the resources they need to be able to take care of Albertans throughout this pandemic.
The Leader of the Opposition.
And Mr. Speaker, there are now more than 10,000 active cases. The threat is real, and Albertans must be able to trust their leaders. But every time the Premier or the Minister speak, we get different stories. On October 20th, the Premier said, quote, "We do not have updated models," end quote. Yet on November 7th, he said, quote, "We anticipate hospitalizations will keep growing with as many as 293 cases within the next few weeks." Guess what? He has updated models. The Premier lectures Albertans to up their game, but he refuses to tell them the score. What is he hiding?
The Honourable Minister of Health.
Nothing, Mr. Speaker. Nothing's being hidden. The models are still the same as they were in the spring. Of course, we have different numbers for. Minister Strathcona is very upset to hear this information, Mr. Speaker, but this is the fact that we have continuing changes in the numbers for our hospitalizations. We're going to continue to work with AHS as we respond to our increases in hospitalizations. We are concerned with those increased numbers, and we're going to continue to make sure that AHS has all of the resources they need to be able to respond to the pandemic and be able to deal with the increases in our hospitalizations.
The Honourable Leader of the Official Opposition for a second set of questions.
Albertans just want the truth, Mr. Speaker. Now, quote, "Alberta TraceTogether is, from our view, simply a better and more effective public health tool," end quote. That's the Premier. We now know that that statement was a bare-faced falsehood. Yesterday, we learned their app has been used to trace contacts just 19 times. More than the Premier's dishonesty, this failure means more people get sick and more people's lives are at risk. Will the minister apologize for the Premier's decision to put his feud with Ottawa ahead of the health and safety of Albertans?
The Honourable Minister of Health.
Speaker, despite the best efforts of the NDP, who continue to want to make this a political issue, this is not a provincial versus federal issue. The contact tracing app in Alberta is exactly what I said, a contact tracing app. The federal app is not a contact tracing app. It's an anonymous notification app. It does not relieve pressures for our contact tracers. The app here in Alberta, ABTraceTogether, is one of the many tools that we have in the system to be able to help relieve our contact tracers. We're happy to have one of many tools. We're going to continue to provide those tools to Albertans to be able to relieve the pressures on our contact tracers.
The Leader of the Opposition.
The minister defends his broken app, claiming it's better than Ottawa's because it's handcuffed to our also broken contact tracing system. You know, Mr. Speaker, the dysfunctional logic of the UCP Blaine Trust over there would almost be funny if it wasn't putting lives on the line. People in other provinces get an automatic text message when they've been near someone who's tested positive. Albertans do not. It is long overdue. Will the minister adopt the federal app, the one that works, today?
Honourable, the Minister of Health.
Mr. Speaker, I quite frankly find it appalling. I find it shameful, and I find it disgusting that the NDP continue to undermine the response to the pandemic, undermining one of the many tools that we have to respond to the pandemic, undermining the credibility of our public health officials. We have listened to our public health officials, including Dr. Hinshaw, who have expressed concern with the federal app, concerns with it sending anonymous notifications and without assessment, sending people to get tested, Mr. Speaker. That's not what Dr. Hinshaw and in BC. I spoke last week with Mr. Dix and his concerns, listened to his concerns, and those of Dr. Henry's. We're going to continue to make sure we're responding to
the Leader of the Opposition.
What is shameful is that this minister is denying the facts. 19 cases off of their app. incapable of being fixed, according to experts. Alberta's contact tracing has collapsed. We don't know the source of 85% of new cases. We are asking sick Albertans to do their own tracing. We're having parents find out about cases in schools from Facebook. The Premier blames Albertans for going to work while infectious, but it's his fault. They don't know they've been exposed. Mr. Speaker, is the minister so stubborn that he would rather let Albertans get sick than just admit that his app is
The Honourable, the Minister of Health.
It is completely untrue. Edmonton Strathcona said something that is totally false. It is not true. She is undermining the credibility of that app. It works. It is completely false that she continues to undermine the response to the pandemic and encouraging people not to use one of these tools to relieve the pressure of our contact tracers. That is what's shameful, Mr. Speaker. That's what's disgusting. That's what's shameful that she continues to do.
Order. I had no problem hearing the question. Order. I don't need help from the Minister of Justice. Appreciate his kindness and generosity, but it's not what I need. The Honourable, the Minister of Health has the call.
Mr. Speaker, that type of behavior from the NDP to continue to undermine the credibility of our public health officials and Dr. Hinshaw and her advice related to the federal app to undermine the credibility and say things that are completely untrue, saying that it doesn't work when it does, is unfortunate, it's appalling, it's disgusting, it's shameful, Mr. Speaker.